Hey Steno peeps, welcome back to another Q&A dictation. Today we're doing a dictation that is between a lawyer and a doctor being sued for malpractice. I will be speaking in a low voice for the lawyer and a high voice for the doctor. Be sure to set your speed controller and let's dive in. Doctor, thank you for being here. Let's start with the basics. Can you explain what procedure you performed on the plaintiff? Yes, I performed a laparoscopic appendectomy on the plaintiff. The patient was diagnosed with acute appendicitis, and the surgery was necessary to remove the appendix. And you've performed this procedure before, correct? Yes, many times. It's a common procedure, and I have been performing it for over 10 years. Can you describe any complications you encountered during this particular surgery? During this surgery, there was some unexpected inflammation around the appendix, but nothing outside the normal risks associated with the procedure. We managed the situation according to standard protocols. The plaintiff alleges that you caused a perforation in their bowel. Do you recall any incidents that could have led to this during surgery? No, I do not recall any specific event during the surgery that would have caused a perforation. Everything was routine, and I followed the appropriate steps to minimize any risks. The medical records show that the plaintiff developed severe abdominal pain and was diagnosed with a perforation 3 days after the surgery. How do you explain this? Post-surgical complications like perforations, though rare, can occur even when everything is done correctly. Inflammation or pre-existing conditions could have contributed to the issue. Is it possible that a mistake during your procedure caused this complication? I don't believe so. I reviewed the surgical video and nothing indicated that a mistake occurred. However, no procedure is without risk, and there are always inherent possibilities for complications. You mentioned following the standard protocols. Can you clarify what those are in this type of surgery? Standard protocol involves careful dissection using proper instruments and avoiding excessive pressure around the bowel. We also monitor the patient closely post-surgery for any signs of complications. Were all post-operative care steps followed correctly in this case? Yes, the patient was monitored in the recovery room and had regular follow-up checks. The post-operative pain the plaintiff reported was not unusual at first, but when it worsened, additional scans were ordered, which led to the diagnosis of the perforation. Would you say that you provided the appropriate level of care for the plaintiff? Absolutely. I treated the plaintiff according to the best practices and provided timely follow-up care. In hindsight, is there anything you would have done differently during the procedure or in the plaintiff's post-surgical care? Given the information available at the time, I wouldn't have done anything differently. The treatment plan and follow-up were both appropriate. Do you accept any responsibility for the plaintiff's current condition? While I deeply sympathize with the plaintiff, I believe the care I provided was within the standard of care expected in these conditions. Post-surgical complications happen, but they do not necessarily indicate malpractice. Thank you, doctor. Let's discuss the specific allegation further. The plaintiff's medical expert claims that the perforation occurred because of improper handling of the surgical tools. How do you respond to that? That's simply not the case. I used the appropriate instruments with care, and there was no indication during surgery of any issue with the bowel. The video of the surgery does not show any improper handling, and all steps were followed meticulously. But could a small perforation have occurred without you noticing it during the operation? In very rare cases, small perforations can occur and may not be immediately apparent during surgery. But based on my review of the procedure and my experience, there was no evidence of a perforation at that time. What about during the post-operative period? Was there anything that could have indicated a developing complication? The patient did complain of some abdominal pain, which is common after this kind of surgery. We monitored the symptoms, and when the pain worsened, we acted quickly, ordering additional imaging and eventually diagnosing the perforation. What's harder than Q&A? Medical Q&A. So I'm going to be trying to think of more medical Q&As to do because I know we could all use practice on this. So be sure to subscribe. Don't miss out on any dictations to come, and I'll see you on the next one.